Hey guys, welcome to Dr. Tayazime. Today we have a very special guest, Betty White, so that she can talk about her issues dealing with osteoporosis. But before we get started, does anyone have any ideas about this issue?
Yeah, my grandma has osteoporosis and she always complains about her brittle bones.
Alright guys, so osteoporosis usually affects people over the age of 65, and it's mostly prevalent in women over this age. It can sometimes affect younger women in some cases, but generally speaking, it's usually older women and sometimes men as well. Osteoporosis is where your bones just get really brittle, and a low peak bone mass, which is something that people with osteoporosis have, is where your bones have a tendency to break and fracture, which is kind of, apparent in the older people, which is why they get it most often. But someone who does know a lot about this topic is our special guest, Betty White. She's been on Community. She was, she starred in the Golden Girls and a bunch of other things. So let's come out and welcome Betty White.
Thanks for having me.
Yep, no problem. So Betty, when did you first realize you had osteoporosis?
Well, I knew it was an extremely common disease, and let's face it, I'm getting pretty old. My symptoms exactly matched up with the symptoms of osteoporosis. I decreased in height, I was shrinking, and my posture became stooped and hunched over all the time. I officially realized I had a problem when I was at Thanksgiving dinner. I was helping my daughter in the kitchen, and I bent over to take something out of the oven, and there was just severe back pain. I knew I had to go see a doctor.
So what type of tests did you have to get to understand that you had osteoporosis?
That's a good question. I originally went to my orthopedic doctor where he ran a dual energy x-ray on me to determine the thickness of my bones and if it was normal or not. Then they did an ultrasound, but not for pregnant people. I'm way too old for that. And lastly, they ran a couple blood tests to see if my calcium and hormone levels were where they should be at. Of course, mine were already lower because I went through menopause. That even makes me more acceptable to the disease.
Right. So how about your lifestyle? What types of things did you have to do to, cope with the osteoporosis?
There is a big change in my lifestyle. Immediately, I had to eat foods richer in calcium to help me, and I had to stretch. Stretching is the most important thing, but anything can be pretty much kind of stretching, even playing with my grandchildren, which is really great. Another thing that I had to do was just cut back and eat healthy, and then I couldn't smoke. That would just make the disease worse. And lastly, I get to wear these super cool in-style hip protectors, which just make my life better.
Yeah,
honestly.
Speaking of those hip protectors, the special people at Kohl's have decided to give everyone in the audience a free pair of hip protectors.
No way.
Now, let's get up Betty White. I want to see these in real life. All right.
No way.
So, yeah, they're pretty stylish, as you can see. They come in a variety of colors. Like, hers are red. You can't really see that, but they are red. Red, yes. They come in all types of colors. They're for pretty much any age group. And of course, you know that they're going to help prevent osteoporosis because you are less likely to fracture your bones when you have a hip protector. So the point is, everyone's going to get one, and thank you, Kohl's, for all your help.